very brief and very consolidated little termitology for our pitching athletes and transformational zones. Lots and lots of videos, documentation with regards to tons of strategies that are phenomenal and awesome. A little tool that we'll use is a dowel. You can use a fence as well. I don't have access to that today, but we can use our imagination. So a basic assessment tool and evaluation tool that allows us to be differential diagnosticians in regards to looking at these transformational zones. So we'll take a look here at what we can do with providing ourselves maybe a little bit of an element of external stability to create motion, but also to kind of evaluate and take a look at seeing what we want to see motion-wise and seeing what are kind of limiting like factors. So we're going to consolidate all the transformational zones pretty quickly. It's very, very, very basic right now, but that's going to allow us to get into all the other video work that we've put together in terms of being really nitty-gritty and being very sophisticatedly complex, but yet simple with these transformational zones and finding solutions to our impairments. So for a TZ1A position, I'll simply have an athlete go up to a fence or dowel in hand, and I'm going to take glove side hand and hang on to the dowel, and I'm going to take a look at whether it's the stretch or the wind up or the slide step, just kind of the motion that we get. Are we getting the motion that we want in TZ1A? We have TZ1B, TZ1C, transformational zonation 1A to 1B. Well, I want to take a look at this huge pivotal point between 1A and 1B because there's a huge loading and unloading of the foot, ankle, and hip complex throughout this transformational zonation. So I'm gonna maybe start the individual. So glove side arm, I'm gonna load up with the dowel and anchor, give me a little stability, and I'm gonna take that lead side leg, and I'm gonna have that athlete transition into a lower extremity, right lower extremity, anterior reach with a lower extremity driver kind of medially. And I'll maybe take a look at a little anterior lateral, or a little anterior medial and a little posterior medial as well. I'll just head straight on out into zonation 1A/1B to make sure that I'm getting the rear foot eversion, that I'm getting the three-dimensional loadability of the right hip, and I'll use that dowel to mimic a glove side driver of the throwing arm right there to give me the frontal plane and the transverse plane load of the lumbopelvic hip complex as I'm transitioning from that motion to and the position of left or right hip adduction into abduction, where I'm starting to open up the frontal plane here as I transition into 1B. So highly relative and important that I'm taking a look at the motion I'm getting at the foot and the ankle, the right hip, and then what's the knee doing? Am I staying locked out in terms of the mid-tarsal and the subtalar joint right there? Taking a look at the knee, the congruency. We need to see a knee that's moving in the frontal plane here towards home plate. And so, a variety again of strategies that we've used together in other video episodes. So when I transition to a TZ1B, we're taking a look at our thoracic spine and cervical spine motion. We're looking at scapulothoracic mobility, our body on arm stability and mobility. We're taking a look at right hip translation rotation. We're looking at right foot and ankle mobility. And so the result of not being able to assume a position or create motion within these transformational zones is some form of strategy the individual is screaming to us with, and that, hey, I can't do that. I'm going to go somewhere else to get that motion. Shoulder, elbow, a lot of times the low back or a knee. So 1B to 1C, and that glove side driver right there is pivotal in terms of allowing that right hip to open up and to take advantage of using the stability and mobility of the lower extremity and the thoracic spine to further progress us into a TZ1C position here. So we'll go through and we'll take a look at some mold positions in TZ1C in which the lower extremity from the bottom up is unraveled quicker, so that the anterior, the front portion of the hip complex, is more or less facing home plate more now, so that we're in effect on that launching pad, ready for flight and ready for takeoff. We're taking a look at the loadability of the left butt and hip complex. We're taking a look at the thoracic spine mobility from the top down to make sure that we're not unraveling quicker to home plate due to maybe a mobility or stability related deficit within the upper extremity. We get this total joint or this total body approximation and fit of a proximal stability for distal mobility and acceleration to further create this disassociation throughout the system. And if we're not giving that very fundamental, if we're not obtaining that very fundamental approach for the individual, we're not authenticating that movement pattern, and we're not moving as efficiently as what we could. And so we'll go into a 1C here, and then ultimately we'll maybe even just take the dowel away, and we'll go after a kind of a TZ2, and then a TZ1C, TZ2, and a TZ1C. There's a lot of things that we do with boxes in terms of taking a look at the left hip function by, in a sense, bringing the ground up, so loading up the hip and the butt to allow us to get more motion in the right hip, while loading up the left butt and hip, and then using the upper extremity, glove side arm as a driver to get in the thoracic spine and the hip from the top down. I would say in terms of a good basic quick assessment that's not very invasive, take your athlete up to a fence or on the mound, whether it's a little dry work, or just get something as simple as a wooden dowel. You can get away with maybe a bat in a TZ1B or a C position. Right here in 1A, it might be a little bit more difficult unless you can get hands on a 36-inch bat to do so. That can be a little less invasive and a little less noticeable for all the conventional heads out there that like to make a big deal for doing things different, but this is very fundamental. It's right to the basics. Take these little ideas for a spin in terms of assessing and evaluating, and check out our video references with regards to the three-dimensional mobility pendulum swing lunge matrix and three-dimensional single leg anterior reach lower extremity pendulum swing driver matrix as ways to assess and to take a look at these transformational zones and the motion that occurs at each foot and ankle specific with those lunges and those stability matrices.